Hello. Our group has selected two recommendations to put into practice from our guideline. These are recommendation number 62, which states, screen people after stroke for communication difficulties within 72 hours of onset of stroke symptoms, and recommendation number 63. Each stroke rehabilitation service should devise a standardised protocol for screening for communication difficulties in people after stroke. Assessment of communication following stroke is important for all stroke clients. Communication assessment or screening provides an initial insight into the altered communication capabilities of a stroke client, as well as providing a baseline for therapy. From this point, decisions can be made on whether further assessment is needed or which treatment path should be taken. Dilworth, 2008, states that early diagnosis and referral is critical for clients who have suffered a stroke. She discusses the fact that overall, stroke survivors with acquired communication disorders have poorer outcomes than those who do not have such disorders, which she says highlights the reason for the need for early diagnosis. The author also mentions the relationship communication deficits have with depression, and in turn their effect on an individual's quality of life. These factors all indicate that the correct method for managing communication in those who have suffered a stroke begins with early assessment. An initial communication assessment should assess communication in a number of ways. Dilworth states that an effective communication screen needs to check whether an individual is able to understand spoken and written material as well as gestures, facial expressions, and prosody, whether they can communicate their ideas effectively through speech, writing, facial expressions, and gestures, and whether or not their speech is easily understood or demands extra effort from the communication partner to decode. In addition to this, she also identifies three key areas of a client's communication that need to be assessed. These are the assessment of the communication impairment experienced by the stroke survivor, the impact that this has on their activity and participation within specific contexts, and the way in which a client's communication environment influences that activity and participation. These points identify why assessment of communication is crucial for clients post-stroke. The ability of an individual to communicate is one of the necessities of human life, and if this is taken away by a health event such as a stroke, then it is the job of the health system to put into place the recommendations put forth by bodies such as the ones who put together the guidelines. Although the recommendations chosen by our group came from the National Clinical Guidelines Centre's Stroke Rehabilitation Guidelines, a search of the current literature found that other stroke guidelines also recommend stroke clients have their communication abilities screened or assessed within a 72-hour period. Some even state that assessment should occur within the initial 48-hour period. Although different recommendations may state different lengths of time during which first assessment should occur, the bottom line is that all health centres that take care of those who have suffered a stroke should be assessing clients as quickly as they can. It is up to each healthcare facility to determine their own expectations of when assessment should occur based on the available recommendations. Within our guidelines were comments from the authors surrounding their research of their recommendations. While the authors were able to recommend that all clients should have assessment or screening of their communication post-stroke, they did not recommend a specific assessment tool. On finding out this information, our group discussed whether this may be an area in which we could develop our resource. During collaboration discussing this, we shared our own experiences working within the speech pathology stroke setting. What we found as a common trend was that we all chose to share that choosing specific communication assessments for specific clients was difficult as an inexperienced student clinician. From this, we decided that we could make a resource that provided information on assessments that are used to assess the communication of stroke clients that could be used by new graduate speech pathologists to aid choosing appropriate assessment tools. I will now pass over to Shannon, who is going to explain to you the resource we have developed as a group. Thank you.